Hey, great. So, welcome to the Voices for Change, Sustaining Momentum Toward the 2027 United Nations High Level Meeting on Universal Health Coverage. My name is Eliana Monteforte. I'm the Director for International Advocacy and Engagement at Global Health Council. I am also a very proud advocacy member of the Civil Society Engagement Mechanism of UHC 2030, and I will be moderating our session today. Before I go into the structure of our webinar today, I do have a few household items I'd like to go through. First, this webinar is being recorded. I know that's usually the first question that we see in the chat. And we're also pleased to offer simultaneous interpretation in French, Spanish, and International Sign Language, as well as access to closed captioning. So right now we ask that all participants select the language that they want to listen to the webinar in. And if you don't know how to do that, there is a little globe at the bottom of your screen. You click on the globe and then you select the language. We'd also love to hear from you. So please say hello in the chat. Let us know who you are, what organization you're with, where you're joining from. However, please know that we will have a discussion and some opportunity for Q&A, but any questions need to go into the question and answer box. We will not be picking up any questions from the actual chat box. So if you want your question to be addressed, please put that in the Q&A box. Any comments, if you have any technical issues, please put that in the chat box and we can have our backstop team help you. So now I'd like to introduce our event and our objectives. So this webinar takes place at a really important moment for the universal health coverage movement. So following a strong momentum that we saw during the 2025 UHC Day campaign, we're now entering a critical phase leading up to the 2027 United Nations high-level meeting on universal health coverage. So our objective today is twofold. First, we'd like to reflect on what the 2025 campaign achieved and highlight the important role that advocates like you and the UHC Day champions played in translating global commitments into action at the country level. And second, we'd like to introduce some practical tools, the Act for UHC report and a dashboard that can help advocates track progress, strengthen accountability, and engage decision makers in the lead up to 2027. So we hope this conversation leaves you not only inspired, but also equipped with concrete ways to sustain advocacy for health for all in the months ahead. So to help us frame why this moment matters so much and why the road to 2027 high-level meeting is more than just a calendar milestone, we're honored to be joined by Dr. Magda Robalo. Magda is a physician and former Minister of Health of Guinea-Bissau, and today serves as our co-chair for the UHC 2030 Steering Committee and Executive Director of Women in Global Health. Throughout her career, she's championed people-centered care, accountable governance, and equitable access to services, all core principles behind universal health coverage. So Magda, I am going to hand the floor over to you, and you can go ahead.
Thank you.
Great.
Thank you very much for the kind introduction and for giving me the floor. Colleagues and friends, as we look toward the 2027 UN high-level meeting on universal health coverage, we must begin with an honest assessment of where we stand. The 2025 ACT for UHC report asks this very simple but powerful question. Are countries acting on their commitments? And the answer is mixed, as you probably know. On the positive side, the foundations are strong. 90% of countries now place universal health coverage at the center of national health policies. 140 countries recognize the right to health in their constitutions. Nearly all WHO member states are reporting on pandemic preparedness, and 91% of national climate strategies now recognize health as a priority. Political commitment is visible. The architecture is there, but impact remains uneven. 4.6 billion people still lack access to essential health services. In 2022, 2.1 billion people faced financial hardship due to out-of-pocket health spending. The pace of progress has slowed since the adoption of the Sustainable Development Goals. Health financing remains deeply unequal. Our income countries spend nearly 2,700 US dollars per capita on health, whereas low income countries spend less than 9 US dollars per person. Out of pocket spending remains dangerously high in lower middle income countries. The projected 11.1 million global health workforce shortage is clustered in 55 countries, 37 of which are in Africa. Inequalities in access to health persist between rich and poor, between rural and urban populations, and across gender. And only half of countries report inequality data in the health statistics. So truly, uh, we could see who is being left behind. So yes, our commitment is strong, but commitment without equity, financing, and accountability does not deliver health for all. The 2027 UN high-level meeting is not just another political moment. It is a turning point. We are entering the final stretch of the SDGs, and at the current pace, we are off track to achieve SDG 3.8 by 2030. The 2027 high-level meeting must move beyond reaffirming past commitments. The second important thing, the 2027 high-level meeting must produce an action-oriented political declaration. The third, it must set measurable targets. The fourth, it must strengthen accountability mechanisms. And the fifth important thing that the 2027 high-level meeting must do is to mobilize sustainable financing. But 2027 is important for another reason. It will shape how universal health coverage is positioned in the post-2030 development agenda. Health systems today face new realities compared to 2015 when the SDGs were established and adopted. There is an ever increasing number of conflict settings. There is major disruption to the global aid flows. We have climate shocks we are dealing with on a daily basis, pandemic threats, workforce shortages, digital transformation, fiscal constraints, and you name it. So the 2027 meeting must send a clear signal. Universal health coverage is not optional. It is central to equity, to economic resilience, and global stability. If we fail to set ambition in 2027, we risk entering the post-SDGs era with diluted momentum and fragmented priorities. This is why we must start early and act decisively. Colleagues and friends, like I said at the beginning, the foundations are set. Now we must build. Between 27 and 2030, we have a very narrow window to accelerate progress. This will require that investments are increased. We need to invest more and invest better. Financial protection needs to be expanded. We need to address the health workforce shortfall. We need to embed equity and gender equality into every single reform. We need to strengthen participatory governance, and we need to leverage digital transformation in a rights-based way. But acceleration will not happen automatically. It requires mobilization. Governments must prioritize universal health coverage in national budgets. Civil society must continue to hold leaders accountable. Youth voices must remain central. Parliamentarians, ministries of finance, climate leaders, digital innovators must all see universal health coverage as part of their mandate. And as we push toward 2030, we must also ask what comes next? Universal health coverage is not a destination, it is a journey. It's like happiness. It's not a destination, it's a journey. The post SDG agenda must embed health equity, sustainable financing, and resilience at its core. The 27 high level meeting is our golden opportunity to ensure that health for all remains a defining principle of global development, not a forgotten aspiration. As I conclude, I would like to say a couple of important things in addition to those I have mentioned before. Please remember that momentum matters, evidence matters, voices do matter. Act for UHC gives us the data. The UHC movement gives us the energy. The 2027 high level meeting gives us the political moment. Now it is hard to all of us to turn commitments into action. And I thank you.
That's wonderful, Magda. Thank you so much for that inspiring intro. I know that 2027 to some people might seem like a long ways away, but it's not. We have a very short window here where we can really advocate, and we've already heard we have a very long way to go with reaching universal health coverage. So now's the moment. So I am now going to transition to our next speaker. So to walk us through the roadmap and upcoming engagement moments, I'm pleased to introduce Leticia Bozio, who is program manager at UHC 2030 and who works closely with partners worldwide to coordinate advocacy and collective action toward UHC. So Leticia, the floor is yours.
Thank you so much, and hello to everyone. I will, I'm sorry, I had an unmute message, so I wonder if everybody was hearing me. I will now share slides. So I think I can just go ahead and share a very quick presentation. And if you could just confirm that you can see my slide. Yes.
We can see your slides.
All right,
that's great.
Perfect. So just to present our audience with sort of a common understanding of what the next steps are and why we start so early on the road to 27, as Magda really set the tone. The ambition needs to start now to get to the outcome we want to see in September 27. And there are plenty of opportunities to engage on the political scene between now and then. The first part of my timeline will be about all of these opportunities, and starting around the corner at the World Health Assembly in May and the high-level meeting on HIV taking place in New York normally in June. And I know given the current context, there have been some interrogations floating around the high-level meetings this year, but hopefully everything will be resolved soon for the HIV high-level meeting, but also the high-level meeting on pandemic preparedness in September. We also have a group of friends which has been extremely supportive of keeping universal health coverage high on the agenda, which traditionally hosts a ministerial event in September during the UN General Assembly as well. And then, of course, UHC Day, this year, 12 December. So these opportunities in 26, they are here to obviously be your regular entry point for advocacy on universal health coverage. But the reason we present them now is because it is important to keep the high-level meeting in 27 already at the back of your mind when you approach these opportunities, and start introducing your ambition, priorities, but also just flagging that the high-level meeting is an important political moment and needs to be seized accordingly. Then when it comes to the process of the high-level meeting itself, we would expect a modalities resolution to be negotiated and adopted sometimes in the early 27. This is traditionally a document that agrees on the date, the panels, the themes of the meeting itself, of the high-level meeting itself. And it's a good starting point, obviously, to know what is and when is everything happening. In terms of publications to watch out for, there will be the SDG progress report as well, looking at, so basically progress on the political declaration adopted in 2023, which usually comes out around February of the year of the high-level meeting. And then highlighted in blue here, we get to sometimes around April, May, traditionally, and that will be set in the modalities resolution, is the moment of the multi-stakeholder hearings on UHC. And this is highlighted because this is the big moment where stakeholders are given the floor, and everything that is presented that day and in writing goes into the President of the General Assembly summary and feeds directly into the draft political declaration. And so this is where the big, basically, mobilization happens. Of course, it needs to happen before and leading up to that moment, but let's say that this is sort of your peak moment for mobilization and engagement directly with negotiators. Then directly after, the zero draft political declaration is published, and then the negotiations start. They usually run until, let's say, July, if everything goes well. August is usually a recess month at the UN, and then September is adoption time. But they can obviously run until September if there are some issues that are unresolved. And as we know, the current climate of negotiations is very different from what we've experienced before. And then September comes around, the high-level meeting happens, and flagging that in 27, there is also an SDG summit. And again, thinking in terms of political engagement opportunities, setting the tone for post-2030, here's another moment to keep in mind, definitely. So in parallel to this, we at UHC 2030 starting the mobilization early, as you've understood. And one way we're doing that is in similar fashion that we've done for the 2023 political declaration and also in 2019 already, is that we mobilize stakeholders really early, and we have them develop a set of advocacy priorities and a narrative that we then hope becomes a common voice, a common set of coherent and consistent messaging for stakeholders to engage in this process. So here in a little bit about the timeline there, the work will start in earnest sometimes in April. It will run until October, when the steering committee of UHC 2030 will look at those priorities and weigh in. At the same time, we'll have updated data presented in 26 with a new report of Act for UHC. I'll say a bit more about that later when I do a deep dive into Act for UHC. And then we'll have a set of global consultations open by the end of the year and going into the next year on this very document. The purpose is to have it being released before the multi-stakeholder hearing, and there is always an official sharing of the co-chairs of UHC 2030 to the President of the General Assembly, and as a contribution to the zero draft political declaration. And then, of course, going from the publication all the way to September, we hope this set of priorities will be used widely to influence negotiations of the final political declaration. All right, I'm going to hand back to Eliana now.
Thank you so much. Great to know the pathway, and there's a lot of different opportunities for advocates to engage throughout this year and all of next year. So wonderful to start putting all those things on our calendar. So now I would like to transition to highlighting our UHC Day campaign and the many champions that were a part of that. But really what makes these types of campaigns powerful is that they're not symbolic representatives. These are advocates that are, oh, I'm sorry, this is the wrong transition. We're actually transitioning, we're gonna get to that. That's a really interesting piece, talking to our advocates. But to help us unpack the campaign first and what we actually achieved, which the campaign was last year, many of you participated in that. And it's always really great to see what the results are of this campaign and what lessons we should carry into 2026. I am delighted to introduce Bethany Kate Lewis. Bethany Kate is a technical officer with the UHC 2030 Secretariat, and her work focuses on advocacy partnerships and ensuring that social participation and equity are central to health governance. So Bethany Kate, so happy to be here. Sorry to almost skip over you, but let's hear about the UHC Day campaign.
Thank you so much, Ileana, and it's really lovely to see so many people joining the webinar. So every year on December 12th, we come together to raise awareness of the urgent need for universal health coverage and to remind the world that health is a right, not a privilege. The 2025 Universal Health Coverage Day campaign focused on the theme unaffordable health costs, we're sick of it. This campaign marked the second year of our 3-year global advocacy push on financial protection. Building on the 2024 campaign, which called directly on governments to take responsibility for delivering UHC and turning their commitment into action, the 2025 campaign shifted the focus to the lived experience of people facing financial barriers to health services. The campaign looked at the people behind the UHC statistics, illustrating that behind these numbers are real human lives at stake. The campaign highlighted the realities faced by hundreds of millions of people around the world who are struggling to afford care and elevated their stories to show how unaffordable health costs are making communities poorer and sicker. And we reminded governments about the true impact of their choices. By centering advocacy and social participation, the campaign pushed for immediate, tangible action to uphold the right to health for everyone, everywhere. It also emphasized that change doesn't happen without people's voices at the table, and that's including and especially young people. And we invited youth to become a driving force of accountability and progress as we move towards the 2027 high-level meeting on UHC and the 2030 Sustainable Development Goal Agenda deadline. So the results of the 2025 campaign have been very positive, thanks to the energy, creativity, and persistence of our UHC Day advocates around the world. The campaign reached further than ever before, with engagement surging across all social media platforms, and with UHC Day messaging and visuals being seen by millions of people worldwide. The number of governments that made UHC announcements and commitments dramatically increased this year. So we had more than 50 governments making concrete UHC commitments, which is a significant increase from 30 in 2024. And this reaffirms the messaging and direct discussion with governments throughout the campaign is continuing to be effective. Media coverage was also truly unprecedented this year. We had over 4,000 media mentions in 135 countries, and that was up from 740 in 74 countries the year before. We also had over 156 UHC Day events in 45 different countries around the world, and we estimate that the UHC Day website received over 9,000 unique visitors between the 28th of November and the 17th of December, with interactions peaking on December 12th, UHC Day. This year, we also made a deliberate investment in youth engagement. Through coordinated outreach and partnership with UHC 2030 and CSEM, more than 30 youth networks actively drove advocacy and action for the campaign, and that was up from 5 in 2024. So big movement there. This is not accidental growth, but the result of intentional organization to build a stronger year-round movement of young advocates committed to advancing UHC and meaningful social participation. We also celebrated 95 UHC Day champions. We had 69 individual advocates, 19 countries, and 7 member state coalitions as part of the prestigious 2025 UHC Champions cohort. These leaders are recognized for going above and beyond to advance universal health coverage, demonstrating outstanding commitment and innovation in ensuring that everyone, everywhere, can access the health services they need without financial hardship. These champions are not only driving progress today, but they will be instrumental in helping us build momentum and political will needed to make the 2027 high-level meeting on universal health coverage a decisive moment for action and accountability. Next slide, please. Although UHC Day has passed, the momentum must continue. So we see UHC Day not as a one-day moment, but a launch pad for the 12 months of advocacy and social participation needed to drive immediate, tangible action to uphold the right to health for everyone, everywhere. Your engagement throughout 2026 will be really critical as we work to build a major push for governments to accelerate implementation and deliver on their commitments to achieve health for all by 2030. So we have many tools and materials available to support you in these advocacy efforts. The UHC Day key messages and the UHC Day toolkit hosted on the UHC Day website will remain active and relevant throughout 2026. We really encourage you to use these resources to continue advocating, mobilizing your networks, and driving action throughout the year. Our suite of UHC Day resources, and that includes the UHC Day Substack and ready-to-use advocacy templates and capacity-building materials, will remain available to provide you with practical tools to influence policymakers at local, national, regional, and of course, the global level. The resources support outreach that connects advocacy efforts directly to decision makers, recognizing that engaging those who shape policy is really essential for translating community voices and lived experience into meaningful action for UHC. And finally, our Health Costs Hurts campaign will also continue through 2026 and 2027, and we invite you to harness it during key local, national, regional, and global advocacy moments. If you have ever been affected by health costs, we encourage you to share your story by posting a video on the social media using Health Costs Hurts, the hashtag, and tagging your decision makers and UHC 2030 and CSEM. We encourage you to mobilize your networks, communities, and partners to share their own stories as well. By working together to amplify voices across your community, you can help illustrate the impact of unaffordable health costs and remind leaders that there are real people and lives behind these numbers. Thank you for your advocacy and congratulations to the 2025 UHC champions. We really look forward to being able to work with you all this year as we really push for momentum into 2026. Thank you.
Thank you so much, Bethany Kate. And now we're going to actually get a chance to meet 2 of our UHC Day champions. As Bethany Kate mentioned, they played a very big role in our UHC Day campaign last year. And I think what's even more important about their voices is that these champions are actively influencing policies and accountability in their own countries. So we're going to have a fireside chat moderated by Dr. Magda Robalo. And so Magda, I'm going to give the floor back to you so we can hear from our great champions. And you are on mute, which is a very common mistake in these webinars. There we go. I think I should be able to hear you now, possibly.
Right.
Oh, not quite yet.
So,
there we go.
Thank you for giving me the floor. And just before we begin this fireside chat, I would like to recognize the incredible scale and diversity of the 2025 Universal Health Coverage Day champions. This year, 69 individual champions were recognized, as well as 7 groups of countries and coalitions in 19 countries, representing a total of 95 individuals and initiatives spotlighted globally for their efforts to advance universal health coverage. These champions are not symbolic representatives. They are people and organizations actively working in their communities to expand access, to strengthen financial protection, and to hold governments to account for their UHC commitments. So please join me today in welcoming 2 important voices for universal health coverage. We are fortunate to hear directly from them as they represent the larger number of advocates for universal health coverage. I'm very pleased to welcome Sibu Malambo, the Executive Director of the Youth Platform in Zambia. Sibu works with communities to monitor health services and bring their lived experiences into national decision-making and accountability processes around universal health coverage. And we are also joined by Tadi Susharetaku from Thailand, External Affairs Advocacy Assistant with the International Federation of Medical Students Association. TADI supports youth-led policy engagement and global advocacy, particularly on financial protection and ensuring young people can influence health policy. I'm told she will answer that she goes by Kati. You are most welcome, and I'm very pleased to be moderating this fireside chat with you. So let me now turn to Sibu. Sibu, a key part of your work is community-led monitoring and accountability. Could you briefly explain how you bring young people's experience with health services into national decision-making and what kind of change you have actually seen as a result? Over to you, Sibu.
Thank you so much, Dr. Mata. And good afternoon, colleagues. Firstly, thank you so much once again for having me. And thank you for your kind introduction. I represent TYP 360, or the Youth Platform 360, which is currently the largest network that represents the voices of adolescents and young people in Zambia, a group that is, I would say, too often the subject of health policies, but rarely the architects of these systems that we're talking about. At TYP3, we believe clinic at every district or doorstep of the young person, but it's about
Maybe, Sibu, maybe you should put your
that actually
just to optimize bandwidth.
Am I clear now?
It's much clearer now. Yes.
Okay. All right. Thank you so much. So basically today, I want to share how we at the Youth Platform are actually bridging the gap between global goals and youth reality through a model of youth-led social accountability. With this model, we don't look for faults, we look for solutions. That is primarily our key focus. We use some basic implementation science, not as an academic exercise, but as a practical tool to prove that when you listen to young people and open a clinic on a Saturday or a weekend, as it were, or bring a mobile health unit closer to the young people at a local hub, the health system doesn't just work better for the young people, it works better for everyone. I look forward to also sharing how our other model, the Indabas, is running youth feedback and turning this youth feedback into national policy. Speaking to our community-led monitoring, in Zambia, young people repeatedly say nothing for them without them. At UIP 360, we have moved from just asking for better services to actually monitoring them. We don't view social accountability as a fault-finding mechanism. We view it as a collaborative feedback mechanism to help our Ministry of Health see what they might miss from behind the desk. In terms of our process for the community-led monitoring, which we have implemented since 2018, which is basically youth-led with young people at the center, co-creating the tools, setting them up, and also implementing it. We bring these youth experiences to the table. Of course, after the process of gathering this data, with youth-led, community-led monitoring, we use this community-led monitoring data, which is real-time, for instance, on drug stockouts, provider attitudes, and wait times. We then bring young people to the table by holding interface meetings where young people can interface with healthcare workers at facility level, using our community scorecard, again designed by the young people, to rate the services being provided at facility level and provide instant feedback. This is a process where even the healthcare worker understands that this process is meant for them to collect feedback and improve service delivery. The immediate action is for them to agree on a specific action plan with timelines on what the facility is going to do in order to address the gaps identified by the young people through that particular interface, where they score together. They rate themselves, the services that young people are receiving, but also as service providers, they're able to recognize where the gap is. So using that action plan, whatever it is that the facility cannot fix at that level is then elevated or moved forward to what we call round table meetings, the decision makers at district level, as well as at national level. So this is where young people sit directly across decision makers to present findings, not as complaints, but also as evidence for change.
Thank you.
We move it further to the Indabas, just quickly, Doc. So for the Indabas, this is where an event that we hold, bringing young people again from district level. We have district Indabas, we have provincial Indabas, then we have regional Indabas, where we bring hundreds of young people to build consensus on key challenges that they face, health-related, but also presents a massive opportunity for young people to co-create solutions to all these challenges that they face along the way. But also importantly, whatever it is that we gather here is taken further to implement. In most cases, working together with Ministry of Health, where we have tried out some weekend clinics, we have tried out taking mobile services to a learning institution, and we have seen that this is the power of bringing lived experiences into the heart of the health systems.
Thank you. Thank you, Sibo, for sharing with us the experiences from Zambia and what you are doing with the young people so that health systems are adapted to their needs. Let me now turn to Kathy. Kathy, again, you have a question where we would like to hear from you, from your lived experiences. You have worked a lot on youth advocacy and financial protection, including supporting young advocates to develop evidence-based political advocacy messages. How have young people been able to influence health policy discussions And why is their role important for achieving universal health coverage?
First, I want to say thank you for your kind introduction earlier as well. And thank you so much for having me. It's truly an honor. And also thank you for your question. So I'll first start off by answering the second part of the question. So why are youth so important in achieving UHC? So in my views, UHC doesn't solely rely on policymakers, not even just youth, but by everyone, because health policies affect everyone and ensuring equity is a shared responsibility. We all view UHC through a different lens depending on our roles, our experience, our responsibility. And for me, coming from being a medical student, I've had opportunities to directly talk and communicate with patients. And one thing I noticed is I realized that some of these patients hesitate before agreeing to test because they're afraid of costs. I see emotional burden in these patients when they have delayed care because they're afraid to visit the hospital. And these are all parts of people's lives that sometimes policymakers may not always see or may not be the first thing they think of. So, but I have to say that for myself, I also don't see the whole picture. As you know, government have to balance budget, sustainability, national priorities, blah, 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 etc. But what we can do, what I can do is as youth, as young people, is offer perspective. And this is not just youth, but for everyone, as these perspective is what help shape these policies through lived reality. As Sibu mentioned, we are able that we share, we will be able to bring depth to the data and help shape more grounded decisions on a government level. So now moving back to the first part of the questions of how young people have influenced health policies. I'm very proud to say that I was part of the organizing committee for the first and second Youth National Health Assembly of Thailand. This is an initiative where groups of young youth organizations such as IFMSA Thailand have come together and create a structured platform that brings young people, whether they're from all disciplines, whether it's health, law, economics, and beyond, just to come to discuss the gaps regarding UHC, health, financial protection, and equity. And these discussions that we have are not just talks, because by the end, we are able to synthesize statements, formal use statements that are later presented at the National Health Assembly, hosted by the National Health Security Office, which is the office that oversees UHC in Thailand. So here it reflects that we as youth in Thailand have influenced policy by organizing these events, consolidating diverse perspective, and presenting evidence-based recommendation in like a more formal policy space. And that shows that our engagement here is not just symbolic. We're not just speaking because we're able to speak, but we are part of the system where we're able to provide feedback in which helps UHC system become responsive to the people that we serve. It's supposed to serve. Yeah. I hope that
Fantastic.
answers your question.
Thank you so much. You did, absolutely. Thank you. Thank you for sharing your experiences in Thailand. Now I have a common question for the two of you, and I'm going to ask you to be very succinct. I will give you only 1 minute. And the question is about looking ahead to 2027, you had a high-level meeting on UHC, and based on your experience, what is one lesson you would like to share with other advocates about influencing governments, and what is one concrete action people can start doing now in their own countries? One lesson for advocates, one action for country level. Starting with you, Kathy, and then moving to Cebu. 1 minute.
Okay, the 1 minute timer is going to be a little bit of pressure, but for me, I think that I used to think of myself as just a tiny dot on a map, and the idea of driving change felt very distant, particularly at a government level, felt nearly impossible. But what I came to realize that it only takes one person to ignite um, passion and spark conversation and to start initiative, because that is when one dot then becomes a network. So my lesson would be that to think big, but to start small, because it's always the first step that's going to be hard. But the small, even if it's just a small step, it's still progress that is moving, helping you move forward. I've also had the opportunity to speak to health policy makers in Thailand. And what really struck with me is they actually want us at the table with these discussions, and they do value our perspective. But their reflection is that sometimes we do a little bit of too much talking and there's no action and no real tangible outcome. So one key action that you can do to obtain this credibility is to start pushing for real initiative, like host forums or policy briefs and invite decision makers to to events that you host, like the Youth National Health Assembly, as we did in Thailand, because this allows us to build a platform to show that we're serious, builds credibility, and that's what's going to get us noticed. So
Thank
yeah,
you.
it's being at the seat. Okay, yeah.
Thank you.
No,
Thank you, Kathy. Thank you very much. Sibo, one lesson for advocacy, one action at country level in less than 1 minute.
Even less than 1 minute. All right. So
as an advocate, I'm sure you know how to convey messages in a short period of time.
Thank you so much, Doc. So my biggest lesson is that influence is built on evidence, not just emotion. Governments are moved by data that reflects the reality of their citizens. When you approach a leader with a report from a provincial Indaba showing exactly why young people are dropping out of care, you aren't just an advocate, you are a partner in solving a national problem. So basically build your evidence base through consensus at local level before you try to influence the global level. So my concrete action is start community-led monitoring today. Don't wait for 2027 to tell your story. Use tools like the Act for UHC dashboard alongside your own community feedback loops. If every advocate here starts a feedback mechanism in their district at their own local level this month, by the time we get to the UN high-level meeting in 2027, we won't just have talking points, we will have a global mountain of evidence that demands a youth-centered political declaration. Thank you.
Wonderful. Thank you. Thank you both. Your experience shows that progress towards universal health coverage does not wait for global meetings with high-level representatives. It starts now with communities and through continuous engagement at country levels. So thank you very much. It was a pleasure talking to you. Transferring now to Eliana, who will introduce the second part, and Letitia. Thank you.
Wonderful. Thank you so much to the speakers and again to Magda for facilitating the fireside chat. It's always so motivating to hear from our advocates that are doing amazing work on the ground. So great to see how, actions can really be seen. And it's not just about words, it's about what you're doing. So great. I do know that Magda has to unfortunately leave us early, so I am going to take this opportunity to thank her for her time and also for all of her commitment to universal health coverage and the UHC 2030 team. So thank you, Magda, for being with us today, and you're free to leave whenever you need. So as we look ahead to the 2027 high-level meeting, advocates will need practical ways to engage with governments, following up on commitments, and support advocacy efforts. So in this next segment, we'd like to introduce a few resources designed to help you to do exactly that. So UHC 2030's From Commitment to Action, a global UHC action tracker. We've been calling it the Act for UHC. Is a really wonderful tool that all of you can use between now and even after the UN high-level meeting to continue to advocate and to hold governments accountable. So I am going to kick it back to Leticia to provide us with an overview of the Act for UHC.
Thank you so much. And I will go back to sharing some slides. All right, thumbs up. All good slides, and I'm set. Liana?
All set. We can see you.
All right, fab. Thanks so much. So yeah, Act for UHC. And before I jump in, actually, we want to hear from you. So I'm going to put Laura on the spot, who's been our Mentimeter whiz for this session, because we've been talking to you for a really long time already. So now it's time that you talk to us a little bit. Over to you, Laura, and then I jump back in.
Thank you, Laetitia. I will, yes, share a Mentimeter link. So we'll drop the link directly in the chat for you to answer the first question. We'll have multiple questions around this section because we really want this to be interactive and have your feedback as we present the tool. So you can either scan the QR code with your phone, or there should be a link in the chat right now for you to connect directly with the computer that has been dropped off by Paloma. Let us know in the chat if this worked well, and then we'll be able to move to the first question.
Great. So as people connect, we'll give you a bit of time to get situated on Mentimeter and read the first question once it is there. As Laura said, it's a tool we're going to be using a few times across the last leg of this webinar. So do keep it at hand, either on your phone, on your laptop. It would be fantastic. The data we'll be collecting today from you actually will help UHC 2030 and CSEM shape future work, how we can support you better, what type of material we can keep producing, and other things. So we really value you taking the time to actually send us some feedback at this time. And yeah, I mean, we can all get very excited about data. I, for one, always get very excited about data. So I can see the diagram here getting moving around. So that's great. We have a few people here already comfortable using data to influence policy. So that's great to hear. You're in the right place. Should we give it another? I mean, 29 responses and we have 100 people online. So I'm sure you guys can do better. Come on.
And just to precise, yeah, for the question, it's kind of general. It's not just Act for UHC data. It's really like if you use data of any sort in your work. And by the way, we're also interested in knowing this kind of data. So if you want to comment further in the chat, feel free.
I'm in your hands, Laura. You call the timer up, time's up when you want, okay?
And I think we have a sufficient amount of response for this one. So what we can see really is that really most of you already like using data to influence policy, which sounds great. We have just a couple, 3 of you saying sometime, which is fair. And one on relying more on lived experience and narrative. So great. I think we all in the right webinar to learn a bit more about useful data for UHC in the next UN high-level meeting on UHC and the Act for UHC tool. So Laetitia, I leave it over to you to present this a bit more. And you can all stay on this link. We'll rejoin for other questions afterward. Thank you.
All right, awesome. Thank you for playing this little feedback game. And now coming back to what we are talking about today, which is tracking UHC commitments, so data about UHC commitments specifically. So in our case at UHC 2030, we've been looking at UHC commitments very closely for a number of years now. Of course, everything started with the SDG targets, 3.8, on achieving universal health coverage, which really is composed of a financial risk protection element and a service coverage element. But the SDG target in itself has been further built upon and complemented with 2 political declarations since then. Basically, member states looking at how they can really achieve such targets. And the link to the political declaration in 2019 is here, and the same for 2023. And so this is something we've been doing actually since 2019. UHC 2030 has been positioning its data tracking work at the unique intersection of between what member states commit to and what member states actually implement and actually do to honor these commitments and make them become a reality. It used to be State of UHC commitment. Now it's become Act for UHC. It has basically a similar philosophy. And now it looks at the commitments that were made in the political declaration in 2023, how these commitments were translated into action. And it's organized around these elements that stakeholders have emphasized in the past as being the most important. So in 22-23, UHC 2030 led the development of the action agenda of the UHC movement, identifying then those 8 areas that are considered most important to stakeholders. And this is how we've been looking at the commitments and tracking progress on these commitments in the meantime. So from 2033 to today, looking at data going back all the way to 2000 in some cases, way earlier in some other cases you'll see, but looking at trajectory also specifically since 2015, the SDGs. Of course, you will, if you are familiar with data in the sphere of universal health coverage, you will know of the global monitoring reports. These reports do not provide country-level data sets. They really provide a global picture and provide comparisons by continents and other filters, but also they really look into SDG targets and indicators specifically. We take a much broader approach in a way. We cover in a more holistically everything that's needed to achieve universal health coverage. And the idea here is to provide you with evidence to drive your advocacy efforts, but really ultimately drive policy action to improve health outcomes. And so the reports are one element of Act for UHC, and the data dashboard is the other element. I'm going to tell you just a little bit more about the structure there. Of course, SDG targets 3.8.1 and 2 are essential. They are sort of the anchor of monitoring progress on universal health coverage. So we've included actually the country level data sets for these 2 targets. We've included those 8 action areas I mentioned as per the action agenda from the UHC movement. But we've also looked into contextual factors. And these are factors that increasingly are determinants of the ability of countries to achieve universal health coverage. And I'll go a bit more into that going on. So just a refresher for those of you who want to know a bit more about the action agenda and what we talk about there. Here are the 8 areas that we dive into. We look into political leadership for universal health coverage, the notion of inclusion and leaving no one behind. We look into laws and regulations, the key pillar of service delivery of health and care workforce, health financing in the sense of how much money goes to health, but also financial protection. How are people protected from catastrophic expenditure? We look into social participation and inclusion in governance, participatory governance, gender equality in health, and the connection between universal health coverage and health security. And because this is a deep dive webinar, we are now going to go live, and I'm going to just walk you through the dashboard. So hopefully everything goes well. Wish me luck. I am now going to share directly the dashboard itself. All right. Still seeing everything we want to see? People online?
Yes, everything looks great.
All right, so moving to, this is the UHC 2030 website. If you want to find the dashboard, so you start here. And if you go to accountability, you're going to find a section on tracking UHC commitments. This is the home of everything connected to Act for UHC. And you can also see everything connected to the data dashboard on its own page. Something important that I want to flag here is that there is also a written guidance note for users to learn how to navigate the dashboard. And so, of course, this is material that you should feel free to consult after this webinar. And you go to get started, and you're taken to a separate website which actually hosts the data that I'm talking about. The structure I just referred to, you'll find on the first page, and some ideas about the views that you can access are described here on the landing page as well, which I will take you through, because I actually think these features are part of the best way to really exploit the full capacity of this dashboard. So this is the type of thing you would really want to know how to use. And then again, the 8 action areas presented here. If I go to the second page, you can learn more about how we really build a model. So you learn more about the analytical framework, where we're coming from with the action agenda, the key characteristics and values that we respect in doing so, a bit more by UHC 2030. And then you dive into the indicators. So as I said, we actually present the indicators that are part of the SDGs, so 3.8.1 and 2. In this case, for example, 3.8.1, if I use the left-hand side navigation menu for the indicators, you'll see that it is composed of a number of sub-indexes, and so you can scroll through all of them, each of them. And this is true for a number of indicators or questions that we want to ask and measure. You'll see that there are several indicators presented. We counted that there are approximately at the moment some 90 indicators based on existing data across 194 member states on this data dashboard. All right, so starting with the SDGs presented here, I am now looking at the global level of the dashboard. So I'll just walk you through the navigation on the left-hand side with the indicators, taking you through the context indicators. So they cover 4 areas here: socioeconomic conditions. You can click on socioeconomic conditions and then see what's going on in terms of GDP and employment rate, fragile state index, etc. Trust in government, participation, protection, and equality, and vulnerability to climate change. Not going to go through in details, just showing you what's there. And then jumping to UHC commitments. As mentioned, the 8 areas that I already read through it. I'll just pick one and basically show you how a section is built. So I'm in the UHC commitments, so this tells you that this is based on the action agenda and the political declaration in 2023. And then each area has a background note that explains to you what member states committed to in the political declaration, which basically justifies why we want to track what we are tracking. In doing so, we had to formulate questions, the things that we need to measure, the things we want to know to assess whether member states are actually implementing actions to honor these commitments. So this is the first section you'll read here. And then you'll get into the indicators. And then I'm going to walk you through how an indicator is presented. So in the first instance, we've been looking at the right to health here. So you will always find in the description of the indicator the what we want to know, so that question that I mentioned, then the indicator that we selected to answer that question, and then the data source. You will see that in the blue line or the blue box below that, you will have usually additional information that enables you to interpret the data or tells you something more about the data sets. In terms of navigation here, you have the year selector on your left. Here I'm presenting a world map, but I have the option to do also bar charts. You'll see that there are other visualization options elsewhere. On the top right corner of a data visualization, you can see where the data is basically stored in a table. So in this case, I'm looking at where the right to health has been recognized and how it's been institutionalized. So if it's in the constitution or it's legislative and so on. So you can see it as a table, which you can also download as a CSV file. And then top right corner still, the I for information is the metadata. So where you'll find additional elements as to what is this indicator's definition, how is it measured, where is the source exactly, how often it is measured, who provided us with it, and the methodology. All right, so still going on in terms of visualization, you can also see how you have different views here. So if I want to know who did what in terms of right to health by WHO region, I would go to the bottom of the screen here. I can also sort through countries by income group. This is the income classification defined by the World Bank, and the settings, if it's fragile settings or config settings or stable. There is one more special feature that I'd like to show, which isn't available everywhere, but one that can be interesting as well is that in this case, for example, if I'm looking at health workforce, gender equality, we have an additional feature here that will tell me whether this, so for example, if I look at different WHO regions in a column chart, and I want to see the female doctors or female pharmacists or midwives versus males. So in terms of the gender here, I can choose the data for male versus female. Of course, this is only available when the data lends itself to it. So it won't be available systematically. All right, so that's about how you see the data. Then there is the level of granularity. What I showed you was global. Now I'm going to deep dive into, I want to see what's happening in a specific country. And to walk through a country of relevance, I asked for some data about the audience today. And so what we know is that the #1 country being represented today is Nigeria. So rather than just randomly pick a country, I'll choose the countries that are most represented. I understand it's closely followed by Kenya and Egypt. So don't worry, there'll be other countries also presented today. So you can scroll through the flags, or you can just do a search, of course, at the top left corner, as you saw earlier when I opened this page. So just to make sure that you see, you understand what you're seeing right here, when you click on a country, you will land on a snapshot page. And so what you want to know is there are a number of elements of country context that have been listed on top, which then tells you how you can compare this country to others within the same region, within the same income group, within the same settings. And so I'll show you how to do that for a particular indicator, for example. All indicators are now tailored to this country. So if I were to go back to the same indicator I used earlier, which was the right to health, for example, same question, same presentation, and I land on the country status. So this data is now for Nigeria. But I can also still see what's happening in the world, or if I choose the bar chart, what's happening in comparable situations. So as I said, either in my same WHO region, income level as per the World Bank classification, or settings. So that is how you use it for a country and how you compare. Coming back here to Nigeria and the snapshot. There's one thing I wanted to say about the snapshot, which basically provides you with a very nicely laid out visualization of some key indicators that are also in the rest of the dashboard, but that have come here together in a sort of easier to access view. They are places where you'll see no data. And so for example, there's this one here. No data would tell you that in the data set we use, or data sets, for the latest year available, or all of the data sets we come across, or all the policy documents and strategy and here plans that we've analyzed, the data set did not have data for that particular country, which is different from the not yet available. And so in this case, if I take unmet needs, you'll see that the snapshot presents has already built in some placeholders for new indicators, new data coming in. And that's thanks to, in particular, the global program of work of WHO, which has proposed to member states a number of new indicators that are particularly interesting for us. And therefore, as I said before, we are updating the report and updating the dashboard this year as well. So by the end of the year, you'll see new indicators, new data sets presented here. So stay tuned for the 26th report and the updated version of the dashboard. All right, I am going to finish on the world map. The last section here, top right corner, I go to world map, is a place where you can see again every single indicator that is included in the dashboard across, so the entire dashboard. I can choose any of them here, let's say civic space rating, and just show you how it works. This belongs to the social participation UHC commitment section, so you'll find it there, which is linked. And this is the question we wanted to address. It's a world map. You have a visual summary of the data here, which you can also minimize. It gives you an overview of the data. Here you have the keys to understand the color coding, the legend of the keys. By default, it's going to show you the latest year, but you can also choose a different year if you want, if you slide this dot here. And you can also choose a country. So if you wanted to know something specific about a country, and as I said, I know Kenya and Egypt are represented today, I could click here, and then the country would appear in this summary. And then it could also take me back to the profile for Egypt. And so I am now in the data for Egypt, starting again, like I clicked here on the country snapshot, and again with all of these information available on the left-hand side. All right, I'm going to pause here for the presentation because we have a new question for you. Stop sharing here, and Laura, over to you for the next questions. And
you're on mute.
I did that too.
Happens every time.
Every time.
Go
It's
ahead.
good I had my camera on. I was saying thank you, Lydia, for presenting like this deep dive, and I hope that it allows everyone here to better understand this great tool that we have with us now. I'm gonna like go to the next question. So following Letitia's presentation, we saw that there is the possibility to deep dive in like one of the 8 action area in this tool, and we were just curious to know from your perspective, in your country context, which area is of most interest for you in your work. So I'm gonna see if Paloma can put the Mentimeter link again, and if you can connect to this question and maybe answer it quickly with, you know, the main area that is an interest for you. And if you are facing any issue joining this Mentimeter link, we can also like, you know, let you answer directly in the chats. Oh, great. Starting to see some response. Awesome. We have health financing and leave no one behind as the first 2. Great. Feel free also to let us know if you're not sure. We know that not everyone is familiar with this section, so there is also more information in the tool about each of them. Yeah, it's definitely a battle between health financing and leave no one behind, with social participation very close by. I think that would be a top 3. Great. I don't know, Laetitia, if you want to go over a bit on that section or if we should move to the other question, as you wish.
So the deep dive, I thought I would probably do now, and then we go back to the other questions. What do you think?
Yeah, I think that's wise. Let's
Because
do
it
that.
seems like health financing is a lead, is clear lead. I unfortunately don't have time to look at all three top. It would be fabulous, but I really hope you will take the time on your own to deep dive. So yeah, I mean, let me share again my screen and go back to here, looking at All right. Does everybody see what I see? Yes.
Yes.
All right. So there are a few ways we could do that. As I said, there are a number of countries here that are proudly represented. So I mentioned Nigeria at first, Egypt, and now Kenya. I understand that the top three represented. So let's go for Kenya. So if I want to know more about health financing in this particular country, my first way to look at it is to scroll down to the invest more, invest better. In this particular case, you have a snapshot view of these indicators here. All right, so in this case, a way to read it is to look at first the health spending. So there are a few ways to look at health spending. In this case, you can look at a percentage of GDP going to health expenditure. And what we've indicated here is not only the percentage, but we've also, because as I mentioned, we were very interested in trend analysis. And we did trend analysis when it was relevant, when we had sufficient data, looking back to 2015. Well, there was a big debate in the team looking back to 2000, but it's maybe a story for another time. But 2015 made sense from basically SDGs time to today. And so the green color and the arrows, they tell you two information. They tell you whether it increased or decreased. Yeah, okay, straightforward, duh, because it's an arrow. But it's color-coded in a sense that tells you it's a good thing or a bad thing. In the sense that as UHC 2030, we take a position on that. And our position is that we would want to see an increase in current health expenditure as a percentage of GDP. So if you see a decrease and it's in red, well, we basically have a position that says it's not ideal for people, right? We would want to see current health expenditure increase. The same goes for domestic government health expenditure as percentage of the total government expenditure, right? So that tells you something about the prioritization of health within the government budget. How much do I prioritize health over other spending, so over topics that I can spend on. And this, for example, if it increases, we believe it's a good thing because it then sends the message that the government is prioritizing health and therefore spending more as in relation to other topics or other money being allocated to other fields. And then finally, government domestic spending on health per capita. So same thing, we consider here that an increase is a good thing. We can look at investment in primary healthcare specifically, same story, right? So government expenditure on primary healthcare and the sources of health funding. So in this case, we have looked at out-of-pocket expenditure, government spending and external. Another way to look at it, so that would be just a snapshot. And yeah, in this case, there are a few dimensions, right? There's the share that is, so how it's split between these three plus other. So the gray is always this other or unknown, which is this 1, 2 sliding here, and over time. And so the other hypothesis that we have, the other position, let's say, that we have here would be that, well, we want people to spend less out of pocket. So what we would want to see is out of pocket going down. And you can see it in terms of this volume here. So the out of pocket going down, the government taking over more. And in the same fashion, you think of dependency. And so domestic resource mobilization versus external funding or international flows or flows of money or international aid funding health, then you would want to see the domestic resource mobilization going up, therefore the government spending going up, and the volume overall of external funding reducing. And so this visualization is actually giving you all of this information at once. Another way to look at it, as I said, was to use the left navigation and jumping straight into the health financing, which we also call invest more, invest better. Same thing, you have a narrative here, which basically reminds you of what were the commitments that member states made in the political declaration. What are the questions that we ask and what we wanted to know? And basically, this is exactly what I just described, right? But this will allow you to have all of the views that I described before. And remember, I'm in Kenya. So I see Kenya first, but I can see also other countries and I can compare. I can see the whole world, but I can also look at charts and I can do comparisons if I wish, right? It's automatic. So I will look at the same indicators here across time with the possibility of comparing Kenya to other countries. Yeah, I guess that's it for health financing. I hope it answered your thirst for this information. I did have one final slide, but given we are getting to the end of our time together, I will share the additional resources I had planned in the chat instead. So back to Laura to bring us through the Mentimeter questions instead. Thanks.
Thanks, Laetitia. Great. So we have some time also for a Q&A session. So what we're going to do now is after this time together, to know maybe a bit more about how you feel about this resource. Maybe if you have some idea on how you could use this Act for UHC data in the coming month, during this year, when we have to mobilize to engage government ahead of the negotiation for the political declaration. So there's a few options here. You again invited to join via the same link, and you can select multiple answers here. It could be, are you going to write a letter to your government representative? Are you going to draft a statement, maybe to speak on a panel? Develop a policy brief that can be adapted also to your main focus area. Write an op-ed or a news article, engage on social media, or contribute to other development of advocacy strategy documents. I'll let you maybe a few seconds here, but also feel free to keep your response, for developing them a bit more. We will have 5 minutes for the Q&A, and we'll love to hear a bit more from you also. Great. We see a bit of everything and some enthusiasm here. So a lot for developing a policy brief and very closely a letter, a draft statement, engage on social media. And if this is helpful, we also have several resources that we've used for UHC Day and that can be adapted also for our engagements, including letter and statements, and for youth speakers and advocates who are joining us, more guidance on how to also develop these resources. That's perfect. Engage on social media also quite a lot. That's good. Perfect. In interest of time, I'll move to the second question here with quick bouncing of ideas. Oh, sorry. About who are you most likely to engage with using Act for UHC data? It could be, it could be government, it could be Ministry of Health, Ministry of Finance, it could be with other civil society colleagues, other youth advocate colleagues. It could be eventually private sectors. So it's really open, and we really wanted just your quick thought about that. Good. Ministry of Health, well, the World Bank, obviously, especially with the recent initiative. civil society partners, advocates, social media also here, Ministry of Health. Oh, I see also private sectors. Awesome. Yeah, majority of Ministry of Health. Ministry of Finance also is a good people are good people to reach out to also for specifically focus, but that's great. Awesome. I'll move to the next question. So we have a few minutes left for the rapid Q&A, but we're like rushing out of time. Okay, so maybe to conclude, how are you feeling after this session? We spoke a lot. We tried to respond as much as we could for question. We still have a few in the chat and in the Q&A, and we'll try also to respond to them later if we can't during this session. And just, yeah, knowing how you feel. And I see a majority of confidence here, which is a good sign, right? And very confident also. And building confidence, of course, that there is a lot of data in this great tool. So it's also like learning while exploring it. So feel free to appropriate, the tool to your own area and focus. Not everything is relevant to everyone, depending on our focus area. Great. I'll stop on this great note for the confidence and ready to use it. We'll have a last question here with several options, and I think it's a bit small on my screen to really see what's in there. It's maybe better on the link for some recommendation on how we could help you use this tool more effectively. So while you answer this question, I know we have only 2 minutes. So I'm not sure we'll have that much time for any question on maybe some, from the Q&A, if you want to develop a bit more, Laetitia, or if anyone want to jump in. Yes, while we're having the response for this question, I think I'll just hand it over to you, Eliana and Laetitia, and see what we can do in the amount of time we have.
Yeah, Eliana, over to you. I'm playing catch up on the chat because I
could not be
presenting and reading the Q&A. So over to you, Eliana.
Not to worry. So I think since we only have 2 minutes and I want to be respectful of people's times, I'll just say we answered all the questions that were in the Q&A, and everybody can go into the Q&A box and click on answered if you want to take a look at the answers to those questions. But I do want to just take 2 minutes or the last minute to thank everybody that participated in this webinar today. So all of our speakers and all of the back-end support that we receive for these webinars, we're enormously grateful to have these opportunities to share this important information and these motivational messages, learning about what our advocates are doing on the ground. So thank you to everybody who participated today. And thank you to all of you in the audience. I think it is so telling that we've had, over 100 people join today. Really glad to see that people are excited about universal health coverage, at least, wanting to learn more about the roadmap toward the high-level meeting on UHC. And certainly this is not the last time when we're going to have webinars like this. We have a year. It seems like a long amount of time, but it's actually very short. So, we've officially, with this webinar, launched the countdown to the 2027 UN high-level meeting. And so what happens between now and then will determine whether UHC remains an aspiration or whether it actually becomes a reality for the people. So we hope that today's discussion helps you and doesn't only leave you informed, but also equips you with resources and tools that you can use in your advocacy, whether it be at the global, regional, or country level. So again, thank you for being a part of this movement, and we look forward to continuing this work together. Bye, everybody.